medical misinformation is everywhere. Dr. Mitch is here for straight talk and to give you the truth.
In the first two installations, we talked about some of the causes of hair loss, the major ones, and what diagnostic studies that we can do. And you'll be able to find shortly a nice panel when people come in with that particular issue and how to work up these patients. Today's job for me, and I'm Dr. Mitch Ghen, thank you so much for watching, of course, is to determine what are some of the things that can be done from a natural perspective. Well, overview is to maintain a balanced and nutritious diet, rich in vitamins, minerals, including biotin, zinc, iron, vitamin D, which are all essential for healthy hair growth. One other thing you tell your patients to do is to massage the scalp regularly to improve blood circulation and stimulate the hair follicles. I often tell patients, even hang over the side of bed if they don't have a tilt table to bring a lot of blood into the brain. Another measure is to look at their nitric oxide. We've talked about this in the past. If it's low, improving nitric oxide generation within the body will improve the blood flow to the scalp. Some general measures, which is equally as important as avoiding excessive heat styling, that often with the tools and harsh chemical treatments that can damage the hair and contribute, of course, to hair loss. Make sure your patients practice stress management. Things that contribute to hair loss is stress. We know that. So activities such as yoga, meditation, regular exercise, all should be part of their program. Use gentle and natural hair care products that are free from sulfates, parabens, and harmful chemicals, all of them which have been shown to lose hair. Incorporate essential oils, rosemary, peppermint, lavender. They can stimulate the scalp to produce a hair as well. These oils have been shown to promote hair growth. And avoid tight hairstyles, pulling the hair, because this leads to the hair breakage and ear traction alopecia just by pulling on the hair. Protect the person's hair from sun damage, maybe wearing a hat, but not too much, because I found when you wear a hat too much, it may be also inhibiting oxygen and other nutrients from the air. Or use some sort of leave-in conditioner with a little bit of UV protection. Get regular trims to split ends if the patient has it. It can lead to further hair damage and breakage. And of course, obviously, avoid smoking and excessive alcohol consumption, as they definitely can negatively impact hair. Stay hydrated, tell your patients. Drinking enough water, because not enough can affect the hair growth also. And consider taking supplements like biotin, about 5,000 micrograms, and saw palmetto to block the 5-alpha reductase pathway, which unchecked would increase DHT, dihydrotestosterone, which definitely can lead to male pattern baldness. Get enough sleep, tell them. A lack of sleep can disrupt hair growth. Good night's sleep, 6 to 8 hours, is imperative. Avoid tight-fitting hats or headgear or anything that restricts the blood flow to the scalp. And last, but certainly not least, my very favorite, tell them to get a good organic castor oil, put into a blender about this much of castor oil, enough to cover their scalp generously, put in 2 or 3 teaspoons of quercetin, mix it up real good, basically generously put it throughout the scalp, leave it on for a couple hours, and then use that gentle organic shampoo to remove that particular product. Do that every other day for 60 days. We found, especially in the post-COVID patients that had hair loss, which was pretty much most of them, this quickly brought back the hair by first noticing the peach fuzz and then growth of the normal hair. Thank you so much for watching this series. And again, I'm Dr. Mitch Ghen.